With probiotics becoming more popular because of their beneficial effects, more people are adding it to their daily routines. As a hygienist, it is important to know what a probiotic is and how it affects the body and oral cavity because it can help aid in the continuous care of a patient. What exactly is a probiotic? A probiotic is defined as a living organism which, when administered in sufficient doses, can help improve the health of a host. What exactly is the difference between a prebiotic and a probiotic? Prebiotics are defined as undigestible food ingredients that are beneficial to the host by selectively stimulating the growth and activity of one or more bacteria that is already in the colon of the host. This helps improve the host health. When probiotics and prebiotics work together, this is called a symbiotic relationship. Symbiotic relationships are defined as mixtures of probiotics and prebiotics that beneficially affect the host by improving the survival and implantation of live microbial dietary supplements in the gastrointestinal tract of said host.
The first study we included focuses more on the possibility and limitations of using a probiotic as a preventative therapy and its association with oral diseases, mainly focusing on dental caries. Study 1 provided a table that we added into our poster board. The table explains bacterial strands that have been identified to decrease dental carie incidences and the growth of carcinogenic bacteria that could be used as potential probiotics. On the left column, you will notice the probiotic bacterial strands, and on the right column, it will give you the mode of action. So, for example, the lactobacillus strands have been identified to aid in periodontal and carie control. There are multiple ways you can administer probiotics, such as tablets, lactobacillus strands in milk or powder form, and drops. A randomized clinical trial showed a reduction in carious lesions in children ages 1 to 9 by using a probiotic supplemented milk instead of normal milk. Drops can be administered to children before bed after brushing their teeth. Drops can also be administered to pregnant women in their last month of pregnancy and children younger than the age of 1. As a result of using the drops, there has been an increased caries-free rate and a decreased rate of proximal caries. In research studies, probiotics are bacteria that are isolated from environments except for the oral cavity. As a result of this, probiotics fail in the oral cavity due to the lack of long-term colonization. So in order for a probiotic to be successful in the oral cavity, it must attach to and colonize to hard tissue.
Probiotics are most commonly used for gastrointestinal health, but they may play a role in bettering the oral health as well. Now, the probiotics recommended for GI health are not going to be the same as the ones recommended for oral health. This is due to the oral cavity is made up of a complex microbial ecosystem that is difficult for just any probiotic to target. Now, with these probiotics, the probiotics can change the microbial makeup of infectious diseases such as periodontal disease and dental caries. To fight dental caries, the probiotic must become one with the biofilm and the saliva. When it becomes part of the biofilm, it has the ability to metabolize sugar. This causes a low acid production. With the low acid production, there is a lower chance of developing dental caries. Now, periodontal disease requires a susceptible host and absence of beneficial bacteria. Probiotics might work by preventing the superinfection by exogenous pathogens and promoting a beneficial host response.
There have been many different antimicrobials studied, and scientists are looking for new ways every day to help prevent caries. Fluoride has stayed as one of the top preventative dentistry for the past few decades, but there have been other methods used, such as caries vaccine and demineralizing agents. Xylitol is a natural sugar that targets oral microflora and inhibits growth of Streptococcus mutans. Xylitol is most commonly used in chewing gum and widely used throughout all ages, but the results are still questionable. I do want to point out that xylitol and fluoride are not considered a probiotic or a prebiotic because they are not living things. Fluoride is a natural mineral and xylitol is a mineral found in plants, whereas probiotic is a living thing and is found in yeast. A new study by Carr, Nakati, Marial, and Cordery are looking into the effects of probiotics on dental caries. Clinical trials have proven that the probiotic Lactobacilli reuteri has helped reduce the amounts of Streptococcus mutans levels in saliva. The study was a randomized controlled trial to help determine if gum containing xylitol and probiotics influenced the saliva Streptococcus mutant counts, plaque, and gingival scores. This lasted for about 7 weeks, and there were 40 healthy children from ages 7 to 12 years old. Group 1 had the probiotic gum, and it contained of 2 different strains of Lactobacilli reuteri, artificial sweetener, and sorbitol. Group 2 had the gum containing xylitol, and it only contained xylitol and sorbitol. The gum was chewed for about 20 minutes after each major meal, and data of the uncontaminated saliva was taken before and after and cultured on an agar plate to see if there were any growth of Streptococcus mutans. The result of this study confirmed that the salivary Streptococcus mutant counts decreased in both groups of children, and both groups were equal in those results. For the xylitol group, it was shown that there was more of a gingival reduction than the probiotic group. The study concludes that chewing gum that contains both probiotic and xylitol are good alternative ways to help prevent caries in children in the addition of fluoride supplements.
Oral probiotics are microorganisms that are administered to the host to benefit the host itself. We reviewed 3 articles that focused on 3 different aspects of probiotics. The first article focused on delaying the progression of plaque, which eventually leads to carious lesions. It also focused on different methods of administering probiotics. It showed a reduction in carious lesions, but failed to have long-term colonization. The bacteria needs to adhere to hard tissues to be successful. The second article focused on probiotic bacteria adhering to tooth structures and become part of the biofilm. This is important because probiotic bacteria metabolize sugar, creating lower acid production, and prevents bad bacteria from proliferation. This study found a possibility in slowing down periodontal disease. The third article focused on the oral effects of gum containing xylitol and probiotics. This study concluded that chewing gum with xylitol and probiotics decreased the amount of Streptococcus mutans count. However, the xylitol group had more reduction in gingival scores.